Hi, my name is Stacy Barden, and I'm going to be talking about improving nursing user experience, also known as UX. Here are the objectives of this presentation. First, we're going to be talking about the importance of the electronic health record, especially focused in nursing practice. We're also going to be looking at the definition of user experience, also known as UX, and focus on the nursing user experience. We'll also look at improving user experience for nurses, and we'll talk about some of the challenges and future goals. So the importance of the electronic health record in nursing really focuses on the usability features of an electronic health record. It was really designed to help promote a safer healthcare environment and really improve the patient experience. Back in 2009, the High Tech Act Meaningful Use Incentive Program, which was followed by the Affordable Care Act, really drove institutions to the point where they had to be utilizing an electronic health record to avoid any penalties, and they instilled incentives to help promote that. So, what is the user experience? It refers to the interactions and the characteristics of anybody who is accessing a healthcare record or a any health information technology application. It really looks at the aspects of the human experience and what that's related to. So first we look at the human computer interaction, which evaluates the aspects of how humans interact with information technology products. It looks at the design of the product, technology, the implementation of the product, and it also looks at evaluation. Ergonomics is another component of user experience, and that's the ability of the user to utilize the technology in a very efficient and effective way through hand contact. Usability focuses on, it goes beyond that human interaction, and it really studies the complex environment of a product and its ability to achieve effectiveness, efficiency, and ultimately satisfaction of the user experience. So for today's presentation, we're going to be focusing on the nursing experience. Nurses actually make up the largest group of users of an electronic health record in just the United States alone, and we're looking at about 3.4 million people. Nurses have a very increased complex patient population, so this makes their job a lot harder. And that's a direct result of increased older patients who need a more comprehensive assessment. So nurses need to have the skills to be able to provide that high quality care in a very timely manner, not get bogged down with utilizing electronic health records to perform those assessments. And nurses ultimately experience burnout and dissatisfaction with electronic health records because documentation can be a challenge. It can be very redundant. There's a lot of clicking and moving in and out of different screens for the application. So this can end up causing nursing burnout. Unfortunately, nurses don't have a very strong voice when it comes to system selections compared to physicians. There's been a lot of studies out there that have been done around physicians' user experience, but not so much around the user experience of the nurse. And nurses need to have a bigger focus on that. Electronic health record systems are very complicated and they are not always easy for nurses to navigate. It makes simple tasks even harder. Even safer evidence-based practices that are built into these programs are not always utilized properly, such as nursing handoffs. So utilizing an SBAR tool is not as easy as it seems, and so therefore it just doesn't get utilized. Health information technology systems are not designed with the cognition of nurses in mind, so they're real critical thinkers and they need to be able to get to document what they need or get access to care plans very quickly without having to go in and out of different aspects of the program. And ultimately, this creates workarounds, which we don't want to see. And that can compromise safety. So what is the goal? The goal of improving usability really focuses on improving effectiveness. It focuses on improving efficiency, and it also focuses on improving satisfaction, because we have to be satisfied with what we're doing. Otherwise, the job won't be as well received, and nurses ultimately will not be satisfied. Patients won't be satisfied. So how do we improve effectiveness? Well, we need to increase safety by decreasing errors. And again, when I talk about you know, safety, we talk about making sure that we look at all the details, making sure that we cover all aspects of the care plans, and being able to document and simple things, but in a very effective way. And also, nurses need cognitive support. So that's one of the ways we look at improving effectiveness, is providing that support. Also, we want to use evidence-based practice, because that's what we've done a lot of research and hard work in, and we want to be able to build that into our everyday practice without it becoming too complicated. Organizations focus on reducing cost of development and implementation of these products, as well as maintenance of the products. That helps to improve efficiency. And organizations also look at decreasing training costs to be more efficient, but this can be a problem because not everybody is educated the same way, or to the extent that they should be educated. So we need to look at how can we improve efficiency by increasing training, by decreasing costs. So individual increase efficiency in workflows is really important, because we need to make sure that we're doing it efficiently in a timely manner, without doing workarounds or trying to cut corners to minimize having to click in and out of screens, or too many clicks or places to document even the same things. And this can lead to errors if people do not utilize the processes that have been implemented effectively. And again, we want to make sure that the user is satisfied, or that this will create burnout. And also, the patients ultimately need to be satisfied with our care to continue providing care for them. The future goals for improving nursing user experience are very important to the success of this type of improvement project. And you really need to look at developing an improvement project that is led by a senior leader, such as a chief nursing information officer, because they have the knowledge and experience to really focus on the nursing aspect of userability and the user experience. Part of this would be to evaluate the user experience, including the human-computer interaction, the ergonomics, and the usability, really encompassing all aspects of it. Also, this project, improvement project, could look at user experience testing steps. And first, you want to look at understanding why they need to do the testing. Why is it important? And then an evaluation should be done to decide what testing methods will fit the organization's needs, and really look at the finite details. So one example is traditional usability methods that can perform contextual analysis and really look at what needs to be, what areas need improvement. And one way they can do this is through utilizing a usability testing method and really understanding the behaviors of the user, whether it's the use of the program itself, whether it's the understanding of how the program works, or what's their perception of utilizing the program. Also, maybe incorporating clearinghouses or utilizing clearinghouses to identify issues and work towards solutions could be very helpful. Development of nursing advocacy committees could be important to collaborate with organizations such as American Nursing Association or the Health Information and Management Systems Society. Also, they need to look at determining what aspects, improvements, again, need to be made to really focus on those details as to what really could improve the nursing experience, especially those on the front line who are working in critical care areas or areas where it's really important to make sure that they're able to utilize the program effectively and efficiently. And also the improvement project needs to look at developing a plan for redesign and policy changes that need to be made in that area and making sure that everyone follows along the same framework. So when we look at improving the user experience, especially for nursing, we want to look at developing a framework for usability improvement. And there's some really key elements that it needs to focus on. It really needs to focus on understanding the characteristics of the user, really understand what it is they need to do their jobs very efficiently, effectively, and to be safe for their patients. It looks at improving task-oriented workflows so that it doesn't bog them down and doesn't become too complex for them to do day-to-day tasks that need to be accomplished. Also, it looks at improving the computer-human interactions. So by that, we're looking at, what really is it about the program that makes it user-friendly, makes it cognitively, do they have the ability to utilize it in the right way and understand the purpose of why they're documenting what they're documenting. It also looks at improving the characteristics of the product. So I think it's really important to work with vendors on understanding the product thoroughly so that they can then look at how to improve features of the product itself. It also looks at developing a timeline to adapt and grow in this interaction process to the process of improving the user experience. And then lastly, it needs to look at better ways to improve communication among clinicians. So it shouldn't be hard for a physician to place orders and nurses to receive the orders, or for physicians to be able to communicate with each other, or physicians and nurses to be able to communicate and nurses to nurses, vice versa. So it's an extremely important aspect of that framework. As we look at the role of nursing in usability improvement, it is really important that nurses have an active role in these improvement projects, because nurses need to have a voice to ensure that the improvements really focus on how to make their work more efficient and more effective and safer for their patients as well. Nursing leaders, it's really important for them to be able to provide education and to empower frontline nurses to really have an active role in that as well. There is a strong need for nursing informaticians to be active in these projects and to collaborate with vendors so that they can provide support for nurses. And lastly, nursing research is really dependent on improving usability and performance of electronic health records so that we can gain accurate information from there to be able to provide evidence-based practice. I thank you so much for taking the time to listen to my presentation today. I hope that you learned a little bit more about the importance of nursing and user experience. Thank you so much.